Okay, today we're going to talk about blood pressure as part of vital signs. And blood pressure is just the pressure of blood on the arterial walls. And it's always recorded as a fraction. So the larger number will be on top and the smaller number will be on the bottom. And that's just because when you blow up or pump up a blood pressure cuff, the numbers start from 0 and they go around to like 300. So when you pump it up to around 160 to 180, it starts to come down as you let the air out. And the first time you hear a beat, that's considered the top number. And then you'll keep hearing it beat, and then the last number that you hear will be the bottom number. So it's going to be a lower number. The top number is just is considered systolic, and the way that I remember that is a cis can contract when she's in labor, and so this is just a contraction of the ventricle. The left ventricle is the most muscular, and that is the one that pumps through to the aorta and then the aorta to the rest of the body. So the normal range is really not 100 to 140. This is sort of some older material. It's really around 80 to 120. And then diastolic pressure is the bottom number, and this is when the heart muscle is at rest. So this is when the heart is refilling with blood, and so it has to go through a rest period in order to do that. So there's not as much pressure exerted on the walls of the ventricles at this time. So it's when it's resting. And the normal range is really around 60 to 80. Okay. All right. Why is that? Sorry. Okay, what can elevate, what can lower blood pressure? So elevated blood pressure is also known as hypertension. And some things that can make blood pressure go up are anxiety, eating, exercise when you're really excited, or stimulant drugs, such as cocaine. Factors that lower blood pressure are depressant drugs, such as opioids, morphines, and then when you lose a lot of blood. So when people go into shock, the blood pressure will lower, especially as the blood starts to, the blood loss increases. So at the very beginning of blood loss, the blood pressure will try to elevate to keep up with to pump the blood. But then as you lose more blood, that pressure is going to decrease because there's just not as much blood there to work the pressure. And then rest, and then shock, which we talked about. Always report vital signs that are not normal. If they're abnormal, report those to the supervisor. When we do combined vitals, they are always charted as TPR, BP, so temperature, pulse, respirations, and then blood pressure. So we don't usually put T equals, P equals, R equals, BP equals. We usually just write it out. 101.4, 60, 24, 120 over 80. Okay, we're going to talk about height and weight. This is measured if it's measured routinely if people have conditions such as chronic renal failure or heart disease, because doctors need to get a baseline. So when you first are admitted to the hospital, you will be weighed, especially if you're in there. I mean, you're weighed regardless, but if you're in there for some type of renal problems, kidney problems, heart disease, anything that's making you increase swelling in the body, then they're going to weigh you probably every day. Because if you gain 5 pounds in one day, then we know that somehow the body is retaining fluid, whether it's because the heart is not functioning correctly or the kidneys are not functioning correctly. So this just shows where a person is as far as health sometimes. If you have a physical exam, it'll be part of the physical exam, the part that I hate the most, and every provider visit with a child. And it's also important for evaluation of laboratory tests and calculation of medications. Daily weights are used to monitor, again, patients with chronic disease processes such as hormone disorders, renal disorders, heart disease, and cancer. Okay, so if you're going to do daily weights, we need to use the same scales. We need to weigh at the same time every single day, wearing the same type of clothing, and you need to ask them to void or empty their bladder before you weigh a patient. Urine in a bladder can weigh quite a bit. And make sure you balance the scales before they step on, which means you make it balanced to 0. And there's like a little lever thing, and once it's in the middle, that's balanced. Always observe for safety. These are a little, especially the beam balance scales, like is shown here in the picture. They sort of move around. So when you're helping someone onto the scales, tell them to step in the center and just sort of, you can't hold on to them while you're weighing them because this will not weigh them accurately, but just be aware that falls are common for people on these kinds of scales. Okay. Now we're going to talk about visual acuity, and this is just used to measure the ability to see. And there's different charts. The Snellen is used to measure distant vision. That's the one that you're most commonly aware of, or that you see the most often in doctor's offices, with a big E and then the little letters underneath it. And we're going to see exactly how far away you can see and how many lines and rows that you can read out. And then the Ishara method test for color, so that's like a colorblind test. And then tonometer measures intraocular pressure. If you've ever had the little puff of air in your eye, or they've taken a little tool, they've numbed your eye and they've stuck that little tool up against it. And then somebody told me recently that there's another test now that they've come out with. So all of that tests for intraocular pressure. They're testing for glaucoma. As far as the key terms that you guys will be filling out, these are some of the definitions on there. You have OD, OS, and OU. These are abbreviations for the right, the left, and both eyes. And then myopia is nearsightedness. So it means that you can see very close up, but you can't see far off. You have to have glasses to see distant vision. And then hyperopia is farsightedness, and you would need glasses to read. So you can see far away, but whenever you're wanting to read a book, you can't see and you have to wear glasses. All right, guys.